today Tamara came to see me. So she's a mum of 3 boys, so as you can imagine she's exhausted, and she started to notice something in her face, in her nose especially, just changing over time and over age, which is very, very normal. So what she's not happy with, and that's why she came to see me, is her nose. So what she found is that her nose is looking more and more on an angle, so it's not completely straight. So she noticing a bit of a deviation of the center of her nose, and also over time what she's really unhappy with is the tip. So it's almost like it's dropped, and that's something that it just happens naturally with age. So she came to see me and she wanted to explore what were the options to do something non-surgical about her nose. She is not ready to go under the knife. She does not want to consider a rhinoplasty. So what I suggested to her after assessing her face is to do some threads lift, PDO threads lift on her nose. So what they basically would do, the PDO threads inserted will help the nose to have more contouring, so help to define the nose, and by injecting them in a specific way, I can just mimic the loss or the lack of the septum on the sides where it's deviated. So it kind of give an optical illusion for the nose to look straighter. And also what I'm going to do, which works beautifully with the PDO threads in a very, very safe way, actually much more than using the dermal fillers, is lifting the tip. So what I'm going to do, I'm going to inject some PDO threads here to elevate her tips. I'm going to put, I think, a couple of threads. I'll see how it goes when I inject her, and that will give her really beautiful lift of her tip. I'm sure she will be really, really happy. She's a bit nervous. She never had anything done before, but I'm sure she will be absolutely fine, and I'm excited. Hi guys, Dr. Nina here today. So we're here today with Tamara, who is going to have a treatment called PDO nose threads. So her main concerns about her nose is the deviation of the septum. So when you look at her from the front view, the nose is not perfectly straight, but it's slightly tilted towards the right side. And also she complains that when she takes photos on the side profile, the nose, look, the tip, it's slightly dropped over time. So she would love to have a little bit of a lift of the nose tip. So what I suggested, instead of doing dermal fillers in the nose, which, as you know, who might not know, come with huge risks of vascular occlusion, necrosis, and actually blindness, sometimes even if rarely, this treatment can be much, much safer. We insert some PDO threads, which means polydioxanone, so completely reabsorbed by the body. So after 12 months, it completely disappear. And what happens, all the skin around the threads will create an own collagen. So she will have a bit more nose definition. It also helps to make the nose look straighter, because it almost like creates the illusion that the nose is not deviated. So we create the actual septum missing with the thread, and then we also lift her tip. So let's start with numbing first. Okay, so I'm going to start by addressing the first concern, which is the fact that the nasal septum is not perfectly straight. So what we can do with the PDO threads is actually inserting them in a way where we give more definition to the side where is lacking, because the septum goes on the side, on the right side. So if we place the threads more towards the left side, that will just give more definition. So when the light hit the nose, it will look much more straighter. And then by using the same tiny entry point, we're just going to lift her tip. So now she's comfortable, she's relaxing, she's just being numb. So that was the most painful thing, I would say. So from now onwards, should be absolutely straightforward, yeah? Just a tiny entry point. Okay, excellent, well done. well done. So the first one is inserted. Feeling okay?
Yep.
Yeah. Okay, just a tiny pressure. Well done. Okay, excellent. Okay, well done. Excellent patient. Okay, just a gentle pressure around. That's it. Well done. You okay?
Yeah.
Very good. Okay. Sorry, just a gentle pressure. Well done. Sorry. Well done. Excellent. Well done. You okay? Yeah. Okay, and then just the same thing again. That's it. Well done. Perfect. Well done. Sorry, this is slightly uncomfortable. Perfect. Okay. Yeah, so as you can see already, just a really nice lift of the tip, really, really safely. So we're just gonna tidy everything up now. So the nose is very vascular, so obviously it tends to bleed quite a lot. So we're just gonna tap and make sure everything is clean before she goes. Okay, so while the bleeding is stopping, so I can just talk you through the aftercare. So you might have a bit of swelling and bruising, obviously, because we worked in this very vascular area, so absolutely normal. You can use some frozen peas as ice packs. Then you can take a paracetamol, any anti-inflammatory that you wish. Absolutely essential not to wear any sunglasses for the next couple of weeks, just to make sure it settles perfectly. And otherwise, yeah, no facials, no steam room, no sauna for about 2 weeks. And then the treatment can be repeated in about 12 months.
Okay.
Okay, so I placed 2 PDO threads in the upper part of her nose just to make the nose look a bit straighter, and also 2 threads underneath just to make the tip lifted, which has lifted beautifully already. So everything looks absolutely fine. The nose even stopped bleeding. So what I'm going to do now, I'm just going to place a liquid plaster. So you can't see it, but it's going to make sure everything gets sealed properly. And then a bit of post-operation, post-treatment cream for comfort. And she's all been instructed with the aftercare. And yeah, all done. I suggest not to wash the nose for the next 24 hours. So I just placed the liquid plaster. So we're just going to make sure it stays there, it seals the entry point beautifully, yeah? So I just want to hold them here and have a look. So obviously a bit of red, but as you can see, the nose is really nice lift. Yeah, and the tip is nicely lifted.